Newsroom.
And good afternoon to you. I'm Fanchon Stinger, live in the Fox 59 newsroom. Indiana's governor giving us an update on the fight against coronavirus yet again today. Health officials reporting now more than 21,000 confirmed coronavirus cases in the state of Indiana, as the number of people tested statewide now jumps to nearly 116,000. Here's Governor Eric Holcomb. It looks as though he is getting ready to begin today's briefing. Of course, we are in day 2 of stage 2 as we begin the process of reopening our state. There are so many states, cities, and counties around the country that are in the same position we are in. Once again, we are expecting Governor Holcomb to update us on the state of Indiana as it relates to reopening the economy and as it relates to the pandemic and where we stand with the coronavirus. The governor, as you see there, is at the microphone. Let us listen in to Governor Eric Holcomb.
On record. Our ICU bed and ventilator capacity are holding steady at about 44% of ICU beds.
Dr. Lindsay, we had a technical difficulty, I'm told.
Oh.
Could you rewind and start over?
Yeah, sure.
Thank you very much.
Of course, yep.
Apologies.
No problem.
Technical difficulty, but we're going to stick the landing.
Okay, I got it. So today, we reported 541 additional cases of COVID-19 in Indiana, which brings us to 21,033 as the total number of Hoosiers known to have COVID. We also saw 62 additional confirmed deaths. To date, 1,213 Hoosiers have died of COVID-19, and another 113 are believed to have died from this disease based on their symptoms, x-rays, and other diagnostics, but did not have a positive COVID test on record. Our ICU bed and ventilator capacity are holding steady at about 44% of ICU beds and just over 80% of ventilators. As I mentioned yesterday, we are launching our statewide testing option tomorrow at 20 sites around the state. These 20 sites will open tomorrow and be open Monday through Friday each week going forward. This testing is for individuals who are symptomatic for COVID-19 or close contacts of confirmed COVID-positive patients when it is imperative that the contact continues to work and or have close contact with at-risk populations. I want to encourage you to register now if you're interested, because each site has limited capacity each day. We want to maximize that capacity as we continue to roll out additional sites around the state. You can register by going to lhi.care/COVID testing or calling 888-634-1116. Registration is open now, so don't delay. We also have been talking to local health departments about locations for the other 30 sites and hope to have those finalized to announce in the next few days. We do have the counties identified where we want these additional 30 sites to open. I also want to remind you to visit the map showing testing sites around the state at our coronavirus.in.gov website. We now have more than 120 sites listed and continue to add more every day. Finally, I want to say that I know that our phased-in plan to reopen has a lot of information and that it's easy to lose track of what can open and when. I encourage you to visit the backontrack.in.gov website to find an easy-to-read, one-page graphic that gives you a quick point of reference. You can also read about specific guidance for all sectors and phases of Indiana's Back on Track plan at that site. I want to thank Hoosiers for all you're doing to keep our friends, family, and neighbors safe. This is a marathon, not a sprint, so we need you to continue to be vigilant as we start to reopen things. Just because the mall reopens, that doesn't mean that you need to go. Wear your mask when you're out and about. Stay home if you're sick so we can protect our elderly and vulnerable populations. Things are going to look a lot different for a while, but we can do this.
Thank you, Dr. Weaver. Rachel, I just want to confirm this is a live show and you caught all that. There was a lot of activity going on over there, but I wanted to make sure all the information that Dr. Weaver shared was heard. Perfect. Thumbs up. Double thumbs up. Okay. Luke Basso is also with us, and he's become the state's procurement officer over at the Indiana Economic Development Corporation, and we've got 4 principles that we look at every day, and it's not just vents and beds, but it also includes PPE. You want to give us an update on our inventory at large?
Yes. Thanks, Governor.
Hi, I'm Luke Basso, Chief of Staff for the Indiana Economic Development Corporation, and today I'm pleased to announce that the IEDC Small Business PPE Marketplace will launch tomorrow. The marketplace will be a secondary source for Indiana businesses under 150 employees to be able to secure PPE. The marketplace, developed by the Indiana Economic Development Corporation in partnership with the Indiana Small Business Development Center and the Indiana Office of Technology, will leverage PPE that is being manufactured and sourced by Indiana businesses across the state to help support supplies. Companies such as Cardinal Spirits and Sugar Creek making hand sanitizer, and World Sail Extrusions making face shields. To be eligible to utilize the marketplace, you must meet these 4 requirements. Be a business or nonprofit organization registered to do business in Indiana with the Indiana Secretary of State, employ less than 150 associates, be identified in the reopening plan as an entity that is recommended to use PPE as a condition of operating in order to comply with safe workplace requirements, and be in the following industries: restaurants, retail, personal services, and office environments. The marketplace, which is initially free of charge, will consist of bundles of PPE based on the size of your business. These bundles include masks, face shields, 1-gallon bottles, and 2-ounce bottles of hand sanitizer. At this time, only the bundles will be available on the marketplace. We encourage everyone to continue to try and source PPE from traditional providers and use the marketplace as a secondary source. Please only utilize the marketplace if you're unable to secure PPE from other places. While we love to be able to fill every request we receive in the marketplace, we'll only be able to fill roughly 10,000 requests in the first week. This is in part because the IEDC continues to secure medical-grade PPE to make sure our frontline workers have the proper amount to continue to fight the virus. When Governor Holcomb asked the IEDC to procure PPE, our initial goal was to secure medical-grade PPE for our frontline workers, and we have been able to do that for the most part. The IEDC can open the marketplace in part because the state has been able to procure additional surgical masks that cannot be used in a medical setting. Also because Hoosier businesses have stepped up to make enough hand sanitizer and face shields for all uses. The Indiana Small Business PPE Marketplace is another step forward for Hoosiers in reopening the state. And Governor, to give you an update on what we've procured, to date the IEDC has procured more than 9 million pieces of PPE, up from 6.3 million reported last week, with more than 3.7 million items delivered already this week, with another additional 500,000 also expected to be delivered this week.
That's fantastic. Thank you, Luke, and thank you, Secretary Schellinger, for standing this up and really hitting the ground running, and you're picking up speed as you go. It's impressive. Also, we have another guest with us this afternoon, as we're all looking forward to certain things coming online and some restrictions being lifted. One area that I know is of interest to most are our local eating establishments, whether they're a diner or a dive or a 5-star. Those will start to come online May 11th for most of the state, with those exceptions of Cass and Lake and Marion County. Those counties will each start a week after they enter stage 2. But for the most part of the state, 89 counties, that May 11th date is something we're all looking at. And these restaurants will start to open up dining room areas at a 50% capacity for seating. And so we've asked the president and CEO of the Indiana Restaurant and Lodging Association, Patrick Tam, to be with us today. Some of that PPE is going to make its way so our restaurants can open up, which is fantastic. But I thought, Patrick, if you're with us, if you could talk about how restaurants have been using time over these last few weeks to be in the position to safely open, and then you're going to in turn introduce one of our entrepreneurs, a restaurateur, Mike Cunningham, after your report as well. Patrick?
Thank you, Governor, and thank you to your entire team, Dr. Weaver and Luke Basso. Dr. Weaver's been a tremendous help on but I can't wait to see Luke's mother and her $1 million smile very soon at Erin Izzy's, she's a fantastic lady. Very quickly, restaurants were immediately impacted throughout the entire state of Indiana, throughout the country. We have really had unbelievable, painful experience throughout this time. We were the second largest employer in the state of Indiana. we've laid off over 200,000 people since this time period. Right now, though, with our Back on Track plan and a very limited but thoughtful, reasoned approach, we produced with our partners with the Food and Drug Administration, Consumer for Food Protection, leading academics throughout the entire country, and produced a guideline with only 2 industry people, one from the National Restaurant Association and one from Ecolab, in terms of opening guidelines. However, we're working with our state health department as well as our local health departments as well to reopen those restaurants in a limited capacity. We have a lot of deep cleaning going on. We do want to thank you, Governor, though, for giving us even this week for most of the state to prepare, to reconnect with our employees and our suppliers as well as we get ready to hit that mark on Monday for dine-in at 50% capacity forward. We have a lot of challenges with regards to a lot of pieces with regards to supply chain and different issues, but there have been some really great things that people have done. One particular issue, and I would tell you that really Hoosiers throughout the state of Indiana really led the nation in this effort, particularly from the restaurant perspective, is moving forward in a grocery type concept. And really the credit here is to the Somm family based here in Indiana. They had a unbelievable meeting with hundreds of restaurants represented on the evening that we were informed that the next day we would be closing dining rooms. They transitioned, they pivoted, and they made sure they took care of their neighbors and their community. The next day, I was able to share that effort, that ingenuity that Hoosiers really led, and share that with my colleagues throughout the country. With suppliers' help, you have that. That's where these family businesses, restaurants are truly indicators of key communities. Today, I'm at Grindstone on the Monon in Westfield, Indiana. This is a 3rd generation restaurant business. Dreams, hopes, lives are started in restaurants. Key moments in people's lives are always celebrated in restaurants as well. We're looking forward to doing the right thing, but also with the Hoosier Hospitality Promise, also making sure that our guests know what to expect and what our team members are to expect. We have a commitment to our team members as well as our guests, but we are also asking a Hoosier Hospitality Promise of key things from our guests. If they're not feeling well, do not come in. If you are exposed to someone that is believed to have COVID-like symptoms, do not come into our restaurant. If you have underlying health conditions, do not come into our restaurants. Let us serve you through delivery, through carryout. Let us continue to serve you, but we cannot allow you to come into our restaurants during this time. It's absolutely critical with regards to our employees, our teammates, and also our fellow Hoosiers and the traveling public. Today, though, I have a great leader in the Indiana restaurant industry and also beyond Indiana with Mike Cunningham, who's been doing some tremendous things throughout the entire state in his locations, but Mike can best talk about those.
Hi, Patrick. Thank you. Yeah, we're excited to get this thing back in gear, and we want to do it safely, though. So everything Patrick just mentioned, this only works if we can get everybody on board, our team members and also our guests, to exercise the responsible approach to being safe with social distancing and all the other things that were mentioned. So I look forward to doing that. We operate 20 plus restaurants in central Indiana, reach all the way up in the South Bend and down to Evansville. And we also operate restaurants in Kentucky and Ohio. And so it's sort of a juggling act for us. We'll approach each state as we are given guidance to do so, and we'll do our best to take on the responsibility we have to keep everybody safe, our team members and our guests as well. But looking forward to, we're all looking forward to getting back to work because that obviously what needs to happen as soon as possible.
Well, thank you, Mike, and thank you, Patrick. Do we have a video that we wanted to tee up? Let's do that now.
Absolutely, Governor. I don't know if you're aware of this, but you probably are through all your efforts. But Second Helpings is a tremendous industry partner, and they really do more than just serve food, and you'll learn more about it in this video.
Thank you.
We're hearing from families who now know unemployment for the first time in their lives. Hard-working Hoosiers who did everything they could to support their families over the years, and suddenly, through no fault of their own, are finding themselves needing help.
So Roman, fill up one of those full. Let me see what it weighs.
We're producing single meals and family pack meals, and those first deliveries are going out today.
Cunningham Restaurant Group, the Mesh, and all of their other restaurants have been great supporters of Second Helpings. This is an organization that not only has a great history with Second Helpings and a great community presence, but also one that has the flexibility that we will need for our satellite kitchen program.
There's 7 or 8 locations in Indy that we could fire up and do this for, and we figured we could do about 10,000 meals a week.
This week alone, satellite kitchens and Second Helpings together will be able to produce and deliver more than 50,000 meals into our community. That's more than twice as many as Second Helpings normally delivers and has the capacity to deliver within our own operations.
We have capacity, so we'll be more than happy to ride this with you, and whatever the need is, we'll meet it.
It has been tremendous to be able to see their passion for trying to do more to help our community.
We're in the Midwest, and we're kind of famous for being kind to each other, and so I think it's just an extension of that.
Hoosiers helping Hoosiers is what we do in Indiana. It's what we're about.
People are amazing when things get tough and people are challenged. We always seem to step up.
Thank you again, Mike and Patrick, and thanks especially to all the restaurants, all those diners and facilities all over the state of Indiana, in the smallest of communities to the big cities that we do, as Patrick said, we just come to identify parts of our lives with, and we really do make memories there that last forever. And so I love the line about Hoosiers are kind. It comes naturally to most of us, and that's what is going to see us through this whole ordeal. Mike and Patrick, as I understand it, are going to stay on the line and be able to answer any questions if folks have them relative to your areas around the state. But thank you to all of our restaurants for holding on, for standing strong, for giving. You mentioned 50,000 meals and 10,000 a week, and I've talked about restaurants all over the state of Indiana going back weeks and weeks and weeks. Umi up in Fort Wayne has been putting together. They surpassed 10,000 meals a few weeks ago. So it's really everywhere from border to border, and we just can't wait to responsibly re-engage come May 11th for most of the state, and then a week after the other 3 counties enter their stage 2. So with that, we'll go right to Q&A and see what's on people's minds.
Steve with KPC Media.
Hello, Steve. Good afternoon.
Good afternoon to you. My question today is about older Hoosiers. Among those that we know have tested positive for COVID-19, the mortality rate for people younger than 60 has been around less than 1%, while it's sitting around 15% for those who are 60 and older. So I know as we reside in stage 2, there's been some guidance that older Hoosiers should maybe take more precautions to protect themselves just out in public. My experience has been that it seems like older people are more likely to wear masks and take some of these precautions, while younger people maybe aren't complying at such a high rate. So I wanted to ask either you or Dr. Weaver, what are things that our older neighbors can do to protect themselves, and what are some things that younger people in the state should be doing to protect the more vulnerable?
Yeah, I'll kick it over, Steve, to Lindsay, Dr. Weaver, here in just a second. But this question is very timely and very important. We know that, I think it's, as of last time I looked, 91% of all of the deaths in Indiana are 60 years or older. We also know that younger folks can carry this and transmit. In fact, some of our youngest are the perfect transmitters of COVID-19. So it really is a combination that leads to some fatal results. That's why we have to be extremely mindful as those April showers brought May flowers and it's bringing us out into this fresh air. We got to make sure that this roadmap that we put together in 5 stages, that's what it is, it's a roadmap. And what we do today will determine where we are on that road to our re-engagement or our recovery or our reopening. And so it's critically important that we pay attention to, as Steve asked, what we can be doing, both whether we think that we're bulletproof and young and we're just going to get over it and we're kind of off the hook, wrong, or if we're vulnerable with underlying health conditions and age being 2 key factors. So can you just kind of elaborate on just how important that is and things that, as Steve asked, what they can do?
Yeah, I think for me and what I advise people is to think about your own parents, your own grandparents, and what would you do to protect them, right? So thinking of my own grandparents and I'm telling them, stay at home, don't go in crowds. I'm telling my own parents who I know really bad want to be able to see all their grandkids. And so, how do we do that responsibly? We have to keep our distance. We need to wash our hands. And then even if you think that you're okay, right? You're invincible, do it for everybody else. Put your grandparents' face on the face of all the people that you're passing in the store or in the restaurant, and just take extra precaution to make sure that you're taking care of them.
Eric Berman, WIBC.
Hello, Eric. Good afternoon.
Hello, Governor. Question actually for Patrick Tam. A couple of things about the prospective reopening. To paraphrase Dr. Weaver a moment ago, just because the restaurants are open doesn't mean people have to go. Is it going to be worth restaurants' while to open up while social distancing is still in place? Excuse me. And secondly, how well equipped are your members with PPE? How many do you expect are going to be taking advantage of the marketplace?
Eric, great question. First and foremost, that is a very challenging question and answer for any restaurant based on the location, the type of food, the price point, and what they are experiencing. Some people may be very challenged at a 50% capacity. I think that's well known with regards to that. We also don't know how consumers will react as well. But that leads into your second question, which is also a great point. For PPE, we're required via guidelines, rightfully so, to have face coverings on all of our employees, including in the kitchen, as well as front of the house as well. So we have to have that. We've always had to meet stringent regulatory health department, Food and Drug Administration, and also CDC. You have a state health department that can also, at any time, inspect us, as well as local health departments. We're uniquely equipped to work in this environment because we have to use the right chemicals that already are CDC approved. We also have to use the proper things for food protection, but we also have to do it in our dining rooms as well. So do we have to be more diligent about that? Do we need to make sure customers are aware of the things that we're doing? Absolutely. That's why in the guidelines that the governor supported and pushed forward, we're to post and make available what we're doing with regards to safety, sanitation, and post that and make that available. Further, every restaurant that's open must have an individual on each shift that's available to any customer to explain those processes and those guidelines and those steps that that individual restaurant is doing. Realize there's a guideline, and we should be exceeding that as well, depending upon their respective locations. The PPE, in terms of what the state is doing, we can't thank the IEDC more. The availability of PPE and different items is very, very hard to find. And personally, I think a lot of our members and restaurants overall will be taking advantage of this. We've also been working through our different supply channels, whether that's Stance Food Service, Cisco, and others, US Foods, that are key suppliers for restaurants throughout the entire state, Gordon as well, that they have PPE as well, that we're trying to make sure that we get into our restaurants. We owe it to our customers, and we owe it to our guests as well. But great question, Eric.
Yeah, and I would just credit where credit's due, Patrick. You all were very quick and thorough and thoughtful when we put that call out and were soliciting your input on how you would responsibly and safely reopen. We didn't change much from what you sent in. I mean, we were already looking at this, but you were way ahead of the curve, and obviously you've had a lot of practice in it, as you alluded to. But we were able to use what the industry had already been practicing and add to it in this new environment. Some things, Eric, will just look different. Obviously, as we phase in, there'll be fewer people in. But this is not unique to the state of Indiana. We've seen this around the world, whether you're in Hong Kong or in Hamilton County, where Patrick Tam is a resident of.
Mark Wilson, Evansville Courier and Press.
Hello, Mark. Good afternoon.
Good afternoon, Governor. Indiana has more deaths per capita than any other state to start reopening so far. Our testing levels remain below what experts have said is needed to reopen and below what Dr. Box has said she wanted to see. And we don't meet President Trump's criteria for a downward trajectory in documented cases over 14 days. You say the reopening is data-driven, but none of these data suggest Indiana should be reopening. So I have two questions. Is it wise to be the hardest hit state to start reopening so far? And what has Vice President Pence said to you about Indiana's reopening plans? Has he encouraged it?
You want to talk about our 4 principles, but I'll take the last question first. Actually, Mark, that's a very timely question, and I'll share what he told me directly. He said he's seen a lot of plans to reopen throughout the country, and he's seen none better than ours. Called last night to talk about this specifically. Commented on how thorough it was, how thoughtful, how it projected out, how we're able to adapt to the facts on the ground, our 4 principles. So he held it up actually as a model, but I would suggest you call him and just verify that. But that's what he told me. You want to talk about the ability to test, all the testing that we have going starting actually tomorrow, as a matter of fact, all that's occurred to date, and then those 4 principles.
Right. So available on our website, you can find 120 sites across the state where you can go and get tested using the criteria, signing up. It tells you the dates and the times. And additionally, we'll be adding 30 more sites next week. But it does require people needing to go get tested. So our job is to make sure that we have the capacity to do so. And those are the numbers that Dr. Box was talking about. She wants to have the ability to do that number of testing. But we need to have the patients go to actually get the testing to get those kind of numbers. So our job is to make sure we have the capacity level high to allow that any Hoosier, if they're sick or if they're a close contact of somebody who is sick, has the ability to go and get that done. Additionally, we have the other guiding principles that we're constantly monitoring. We share only a minimum amount with you on our website. There are other places that you can go, for example, Regan Street, to find a lot more information, to see hospitalizations across the state, and a little bit more of that detail, so you can have a little bit more insight into several of the data pieces that we're constantly monitoring.
Yeah, and Mark, just to repeat what I've shared before, our kind of North Star was to make sure that we had the resources available to care for those who needed, that were in need of that care. And we've had that. You report our 80% plus or our 44, 45% in terms of vents and ICU beds that are available, that hospitalization rate, what type of runs are we taking? And so we've got that in place. If that becomes jeopardized, we will reassess that. Again, I'm going to be like a skipping record all week this week. Again, how we conduct our affairs now, this week, as we start to lift some of those restrictions, they will have an effect. Hopefully those are a positive effect, and we can stay on this road to reopening that we've laid out on yesterday, May 4.
Victoria Ratliff, the State House File.
Sure. Hello, Victoria. Good afternoon.
Good afternoon, Governor. My questions are for Dr. Weaver. Do you happen to know the number of people who have already signed up and registered to be tested at those sites? And is it a goal for Indiana to ever offer testing to anyone who wants it? And if so, why or why not?
Those are great questions. So I actually do not know the number right off the top of my head of the testing site, but I will say that I wanted to test it out myself just to see the process. So I went through the process, and it took me 3 to 4 minutes. It was relatively easy to get on there and register and answer the questions. It'll show you which sites are closest to you based on mileage, and you can pick your site, and then it gives you times to pick. So pretty easy process. So I do encourage people who fit those parameters to go get tested. As far as anybody getting tested, so the issue is, if you do get tested, just you're not symptomatic, you don't know whether or not you're symptomatic, it's difficult to know what that information actually gives you. So just like any test that we do in medicine, we always want to know what is the expectation to do with the results of that test. So over time, as we get more information from the CDC, as more research is done, and we learn a little bit more about this test and what it actually means, we've opened up testing and expanded it a little bit. So things may change in the future, but we're pretty confident with what we have set forward at this point, that we really can test the vast majority of people in the state of Indiana if they are symptomatic or if they're in close contact with somebody who has COVID-19.
You want to talk a little bit about the Fairbanks study and that whole test and who we're testing there as well?
Yeah, so in the IU Health Fairbanks study, we randomly selected people across the entire state, and they got the emails, text messages, et cetera, to select them. And then we did a swab test and also a serum test just to see the level of prevalence out there. We know that the swab test for virology is not that great for people who don't actually have symptoms. So we keep all that in mind when we actually look at the results of the test, that even though we swab some people and it came back negative, they may actually be an asymptomatic carrier and could be positive just because it's not a 100% good test.
Yeah, and that's up to 100,000 over the course of a year, right? 5,000, 5,000, 5,000, 5,000, 5,000.
Right.
Rachel? Sheila, WLKI.
Hello, Sheila. Good afternoon.
Good afternoon, Governor. Can you hear me okay?
Crystal clear.
Great. Hey, thank you again for the opportunity to speak with you and your team today. My question is about the availability of meat in grocery stores and local meat markets. It's starting to be a concern of Hoosier consumers and families, and additionally, meat processors and distributors meeting the demands not only of residential shoppers, but now with the reopening of restaurants. What is your team looking at to help keep supply available?
Well, you're going to get Sheila a full report in the next couple days. We've been working on this for much of the last week, not just in Delphi and up in Cass County near Logansport, but making sure that we're doing all that we can to keep that food supply up. So we've been working with our federal partners, working with this administration, working with the individual companies to make sure that they are safe places to work in this environment that we find ourselves in. We expect, obviously, the plant up in Cass County to be up and running sometime in the near future when it's safe to do so. But we've been up there all weekend, actually. We've tested folks there to make sure that they know who is in their facility and to make sure that we're doing all that we can to contain any spread that occurred initially. And so we'll leave no stone unturned. We're on the ground. We're working with the local community, working with the local health department, working with our federal partners. And this is an example of, I mentioned 7 weeks ago that we needed to make sure that our meat and medicine pipelines remained flowing. And this is just a reminder all over the country, but here in Indiana, we're not immune, that you have to have surge teams that are ready to go and get in there and hit it. And that's what we've done in Indiana.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Good afternoon, Governor. In an op-ed this morning in the Indianapolis Star, Eli Lilly CEO Dave Ricks writes that Indiana needs to scale up its testing from 2,000 to 3,000 tests per day to 20,000 or 30,000 a day. Even with the Optum Serve contract, which I think would test 100,000 Hoosiers or so in its first month, there's still a yawning gap of maybe 800,000 between the Eli Lilly number and the number that we'll be able to test over the next 30 days. Does the state agree with that assessment? And if so, is OptumServe able to scale up in, say, June to 900,000 tests a month?
Do you want to take that? Or, I mean, Dr. Box has commented on this very early. I think she threw out the number 6,800, but you want to talk about the...
So we're working really closely with Lilly. Lilly has helped us out tremendously from the very beginning of this outbreak, stepping up and saying, what can we do to help increase testing here in Indiana? And they're also helping us in moving forward. So we're working really closely with them to see what labs can we get up and going to do the testing here right in Indiana, so we don't have to rely totally on other labs outside of the state. So the great thing about Optum is that they were able to come in, they have 20 sites starting tomorrow, and they're going to have 30 sites next week, and be able to include that testing. So our goal is that that's just a short-term thing while we get all of these other labs up and testing. So we're prioritizing based on the reagents that we know that are available, based on the market, where we can get that testing going, and then we're working with the local communities so we really can get that testing back out into our providers and back out into the communities.
Jody Kaufman, WRBI.
Hello, Jody. Good afternoon.
Good afternoon, Governor. How are you today?
Very good. How are you?
I am wonderful. It's Cinco de Mayo and Taco Tuesday.
Pleasant reminder.
Hey, my question is in regards to some information from Friday. You just kind of casually threw out that the state's surplus would be going to the counties based on population. And I haven't really heard much detail on that since. I was wondering if you could provide some for me, including will our locality see it and what are the specifications to how they can use the money?
Thank you, Jody. I tried to get someone to ask this question 2 or 3 times, and you did it. And Chris, the director of our Office of Management and Budget, is here to give you some more details. I think you had another 4-hour meeting this morning?
We did.
Okay. You want to give us an update on what came out of that?
Absolutely. Chris Johnston, Director of Office of Management and Budget. And Jody, if I may, I would like to correct your question a little bit. You said that the money would come from our surplus. The money is really coming from the Coronavirus Relief Fund, part of the federal assistance that we've received in the last month. And part of that is the money does come to the state, and certain municipalities are eligible for direct distributions. We only had one of those communities that met the federal guidelines, and that was Indianapolis, Marion County. But there is an expectation, and we plan to use this locally, and that first $300 million is our first step to do that. We are going to ask the local governments and local entities to use the money according to the federal guidelines. The challenge is that they're continually updating those guidelines. We just received a new set of frequently asked questions last night, so we're revising our application and directions out to excuse me, the local entities. We hope to do that in the next week or so, but again, we have to take a look at these new guidelines. What they'll be able to use it on are public health and medical expenses such as PPE, sanitization, other public safety expenses. And some people have asked, why $300 million? We felt that that was a good allocation to start with to see what the demand is out around the state. And the other thing that we'll be using it for, you heard last week, extensive descriptions of the additional testing and also the contact tracing. And so those are eligible expenses that we'll be using some of that money here at the state to pay for those costs, which have a statewide benefit.
Lindsay Erdody, the Indianapolis Business Journal.
Hello, Lindsay.
Hello, Governor. We'd like to ask a little bit more about the small business marketplace. With the 10,000 requests that you may be able to fulfill, what happens after that? Is it going to keep being replenished? And what happens to businesses who might not even get in on that 10,000 requests?
Yep, great question.
Thanks, Lindsay. So it will be replenished. We're getting orders in, as I mentioned, daily. So in order to get to the market the fastest, we had to pick a day that we were going to cut off in receiving PPE. So for this week, it's today. So orders will start going out Friday. But on Friday, we're also getting another large order of mask and hand sanitizer to be able to start the marketplace again at that point. So, And then for businesses that aren't able to get onto the marketplace just yet, we'll be able to take a list of those businesses that come through and be able to help get them the next round of next bundle and the next round when we open back up the marketplace.
Thank you.
Elizabeth Finian, PBS Michiana.
Good afternoon, Elizabeth.
Good afternoon, Governor. We've been getting a lot of questions about your decision to exempt churches from the attendance restrictions that are imposed in other types of businesses and gatherings. And I wonder if you could talk a little bit more about that, given that in past briefings, you had mentioned that the virus doesn't discriminate or behave differently based on where you are, whether you're sitting in the bleachers or the pews, and just talk a little bit more about that decision to allow those church gatherings to be as large as that particular congregation feels comfortable with.
Yes. Still need to practice good physical distancing, still need to practice additional hygiene practices. We felt that as we were phasing in, this was a good kind of test case or control group to see if we could responsibly start opening up on this front. We didn't want to go all the way and just across the board open it all up, and we knew just how important our spiritual guidance is to our wellness in addition to our physical and our fiscal well-being. Spiritual ranks real high up there as well, but it was dependent upon congregational leaders, our worship faith leaders, to make sure that they were leading their flock, so to speak, in a safe way. And so this was just one. We could have maybe added a few other sectors, but felt like that would be premature to go all in across the board with those certain parameters. So this was a first step toward that we felt was responsible, and we just wanted to be more safe than sorry if we went too much too fast.
Kayla Sullivan, Fox 59.
Hello, Kayla. How are you?
Doing well, thank you, Governor. Are private prisons, VA hospitals, and federal prisons required to report COVID-19 numbers to the state? Are they included in the current numbers? And if not, why?
Yeah. Dr. Doss is elbowing out Carter.
Kristen Doss, Chief Medical Officer for Indiana Department of Correction. I can speak for our jails and our prisons in the state, and we are required to report within 24 hours all positive numbers to the State Department of Health. The Department of Correction goes an additional step, which is to notify local health departments of anyone who we have releasing back to the community or that local county, just to make sure that all the efforts from a medical perspective are coordinated, all the quarantines and isolations are completed, and if there's any questions, they can ask us those questions directly. Thanks.
Thank you.
Jessica, WEHT.
Good afternoon, Jessica.
Good afternoon, Governor. How are you doing today?
Very good. How about yourself?
I am doing well. My question is in regards to your plan. In the phase plan, you've talked about the need for those phases and the expected dates to be flexible so that they can be paused or scaled back if necessary. What data specifically will the state use to determine if that needs to happen? And additionally, are there specific thresholds that the state will need to meet to be able to continue with the plan as you have it laid out now?
You might want to add to this, but primarily we'll look at those same four principles: our hospitalization rate, our ICU bed, and our vent availability. We'll look at our ability to test as we ramp that up and as we expand that, and then equally so, and one of the reasons why Marion County, we wanted to wait until the 11th of May is that's when our tracing effort really, as a state organized uniform process with all of our local health organizations, that's when that stands up. And so having the resources, looking at the hospitalization rate, making sure that we can care for folks, and then making sure that we can test and trace Hoosiers who may be positive are the principles that we look at that guide us on this roadmap. But as you point out, our behavior is a big part of that. That's why all of these recommendations, when we solicited out to all these 17 different sectors and said, tell us how you will reopen responsibly, that was critically important. Now it's up to us. Now it's us reacting to re-engaging. And if we ignore those recommendations, then that roadmap may change. If we're ahead of the game and we punch our way through this, we can adjust. But you will start to see more clarity, Jessica, as we enter June and July, on June and July. Just like the clarity you see in June, you'll see that being added in as we go.
Sherry with the Indianapolis Star.
Hello, Sherry. How are you?
Hi, I'm fine, thanks. How are you today?
Good, thank you.
Thank you so much. I have a question about the homeless population. I know that those who test positive will be ensured that they are self-isolating. Has there been any discussion of moving towards putting those who aren't symptomatic and haven't been tested, the homeless population who aren't symptomatic, haven't been tested, in hotels or other facilities, especially given some of the experiences of other cities like Massachusetts, which have found incredibly high rates of positivity among homeless shelters, even among residents who are not showing symptoms?
You want to talk about what we're doing in?
Yeah, so I wish Dr. Sullivan was here, but she's working a shift in the ER today. It's her shift day. But I do know that last time I talked to her, which was yesterday, she was happy to report that we haven't had a single positive case in any homeless shelter here in Indiana, and it's because of all the work that she's done. I unfortunately can't speak extensively about it, but I do know that her and the entire team at FSSA are paying very close attention to that and have from the very beginning.
And have housing resources put in place. But Sherry, we will make sure that Dr. Sullivan, who will be with us tomorrow, can elaborate even further than Dr. Weaver just did. Yes.
Rob Burgess, the Wabash Plain dealer.
Hello, Dad.
Hello, Governor. Good to be with you again. Dr. Weaver, we hear about recovered patients, but what lasting damage are you seeing? Where in the body and how severe and how many? And for patients who don't make it, in the future, will you be sharing any breakdowns of comorbidities the same way you shared other demographic data for the state?
Yeah, so we're collecting as much of that information as we possibly can from all the different data resources that we can as far as comorbidities go, as well as following them out over time. So you are correct. And any indication, any time when someone's really sick and they're in the ICU, they do have some long-lasting problems from that. Weakness, if their oxygen's really low, what damage does it cause to their kidneys? Their blood pressure's low, that can cause minor strokes. We have seen people having more clots with this condition. So those are all the different things that we're following over time. Some people recover greatly and are doing great, and other people will have some long-lasting problems. So things that we're going to be looking for, and we're going to learn more over the next weeks and months.
Tom Davies, the Associated Press.
Afternoon, Tom.
Hello, Governor. Have you been able to receive any information yet from the Fairbanks testing study? Since when it was announced back on April 23rd, they plan to have some quick initial results for you in your decision making.
Yep, great question.
Yeah, so they are analyzing all of that information. We have a conversation daily working with Zotec, which is the company that helped us collect all that information, the Fairbanks team, making sure that we're pulling together they ask lots of symptom questions. Have you been around anyone that's had COVID? Was someone in your house have COVID? Do you smoke? So they're taking all those different data points, as well as all the locations district-wise, the 10 preparedness districts, to see really what the levels are for based on demographics, based on where they live, how many people tested positive for the virus, and how many people had antigen. So as soon as we have that and something that is easy to share with everybody, we're happy to do so. And I think another important thing, and the governor mentioned this earlier, is this really is just one piece of the study, and it really does take us testing again and again and again, doing the same thing to really get some more information as we move forward.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon. I was wondering, Indiana has a large Amish population. Several people in my area are very concerned about large weddings and church functions that are starting to happen again. Yeah. What is the state doing on this topic?
Yeah.
Yeah, so we are aware and we have been talking to the local health officers and other community leaders up there, the Indiana State Department of Health has, as well as we're looking to doing some testing in the Amish community as we move forward here in the next couple of weeks. So thank you for asking that question. Definitely something that we're paying attention to.
Brandon Smith, Indiana Public Broadcasting.
Hello, Brandon.
Hey, Governor. My question is maybe for you, maybe for Luke. So Lindsay asked about what happens if companies can't get enough of the PPE from the marketplace, but you talked about replenishing it. Well, what about those companies who either don't qualify for the marketplace or those who, I mean, all of the resources will eventually be exhausted theoretically. So especially when some companies are required to have PPE in order to reopen, what are they supposed to do?
Yeah, so thanks, Brandon. I mean, I think first and foremost, as I mentioned, we want to make sure we're getting the correct PPE to our frontline workers. So that's number one priority. But we, as the governor has encouraged, and Dr. Box and Dr. Weaver, for companies to start early to go get PPE. This is a supply chain that is moving every day, either an inch or a mile. We've seen the supply chain open up this week, being able to get more and more access to PPE within the state. It's not going to be an easy process, but if you continue to go to your traditional PPE providers that you worked with in the past, they are opening back up. If you have questions, we'll be happy to help point you to some of the right directions here at the IEDC. But I would encourage, Patrick mentioned restaurants earlier. I would encourage restaurants, and I would encourage like industries to work together to go secure PPE. Trying to find 10 masks right now is going to be more difficult than it would be to try to find 10,000. So talk to your neighbor businesses, talk to your neighbor restaurants, and work together, and that will make the supply chain much easier to go out to get these, get especially masks right now.
And I would just add, Brandon, I'm always reminded on a daily basis that when we find ourselves in a time of great adversity or challenge, this also creates an equally, if not more so, opportunity. And I'm just encouraged by these companies. I've mentioned breweries before multiple times, but companies like Chemcrest up in northern Indiana who turned on a dime and started to add to their supply chain disinfectant, and so they may be had long been in the auto industry supply chain. Now they've turned some of their supply lines into providing, and on this front as well. And so, one of our long-term goals is, as we create a supply chain based here in Indiana, Indiana-made products that can support our businesses, but also around the world. This is going to be a source of enormous pride for us as we build up here and onshore products back to the state of Indiana. Huge opportunity for us. And this is a state, we make things. We always have. We innovate our way. It's who we are. It's in our DNA. And this is a time that allows us to move into this field like maybe no other time.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. A couple questions. I think both of these go to you.
Imagine that.
I've gotten a lot of calls and text messages from young people and older folks about youth sports. This spring, this summer, will they be able to have them, whether it's Little League practice games or single games, because they weren't quite sure how they fit on the state sort of metric parameters that you gave us. And number two, I think I speak for all of us in the press corps. How long do you think you'll keep doing the daily briefings? As are they going to be every day, or is the situation going to change? Is it going to switch like a Tuesday, Thursday, Monday, Wednesday, Friday,
or I'm taking your suggestions. Well, let me, first things first, the youth, I think you asked about the youth leagues or youth sports. That is a June 14, I believe. I'm looking out for a nod by someone. Jane's given me the yes, June 14th. That's where it is in our plan. However, just keep in mind that what I said is our behavior is going to affect, our behavior today will affect where we are in June and July. But we've pegged that as June 14th when these leagues would be able to resume their activity. Obviously, leagues themselves will have something to say about this. They may be later, by the way. They may be after June. And so we see that with different organizations and different leagues. And in terms of summer camps, which often gets lumped into that same category, we've pegged for June 14th, which is stage 4. But we're also awaiting some CDC guidance on that front. So more to come, but we're looking at June 14 as a time to resume as it stands right now. In terms of how often we'll continue to do these press briefings, daily press briefings, that's to be determined. Feel free not to call in, Abdul, anytime you don't want to. But we don't foresee this going on, obviously, the rest of the year, but we want to make sure first and foremost that the public that is paying attention to what you're covering, the facts as we lay them out, and the reasons why we're making decisions and what those decisions are on a daily basis as we entered into the storm. Dr. Weaver mentioned yesterday that we're still kind of on that plateau, and I'm still in a posture that we got our best, I guess you could say our best offense is a good defense. And we've got to be defensive about how we conduct our affairs, because it's having an impact on this roadmap, every single stage. And so, yeah, stage 2, obviously we're looking at halfway in there as we get into stage 3, but not there yet. So to be determined.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m.
Listening to the governor and his team providing an update for us on this Tuesday afternoon on the state of the coronavirus response and also the state of our city, our states, our counties reopening and getting people back to work. I first want to update you on the numbers that the governor gave us today. 62 new deaths as of today, that bringing the total deaths in our state to 1,213. Let's continue to pray for people who are fighting for their health and also the families of those who have lost loved ones. Some of the top line points that he shared with us today. We now know that 20 statewide testing sites will open tomorrow. As testing ramps up, 30 additional sites will be going online in the next few weeks. That is going to be significant. We will continue to follow that closely. As testing capacity does increase, the governor reminding us today to stay vigilant. Social distancing, all of our hygiene practices, all of that has to remain vigilant. And as businesses begin to open, the governor says support is rolling out for businesses and all of us who shop at those businesses. We heard from some of our business leaders during this update today. We know the PPE Marketplace is launching tomorrow. That marketplace is for small businesses of 150 employees or less. That marketplace will make sure those small businesses have supplies that covers retail, restaurants, personal services, and also office spaces. And they say they will continue with getting more supplies online to help support our businesses and our employees. Many of you watching right now, as you wonder, how am I going to go to work? How am I going to stay safe? The state is continuously working on how to answer those concerns. We also heard in terms of the restaurant industry, restaurants, as you know, will be opening at 50% capacity starting May 11th, except for Marion, Lake, and Cass counties. But the governor highlighted Second Helpings also today, and so many other restaurants who kind of changed over their focus to help families. So many of our families now dealing with unemployment. And they also reiterated to us that support will continue as we continue to open more sectors of our economy and more sectors of the state. The governor also sharing kind of an encouraging note today that Indiana is being held up as a model nationwide when it comes to reopening. Now, with that being said, he's also very aware, and we are all very aware, there are still a lot of questions, there are still a lot of concerns, and those will be addressed as we continue to move forward. And you can always count on Fox 59. We are going to continue to be with you, to support you, to inform you. We will have a full breakdown and complete coverage of everything we heard today, where we are up until this point. You will see that starting at 4 o'clock, Fox 59 News at 4. In the meantime, let's continue to pray for our state, for our leaders, for our families, and most importantly, for each other. And for right now, I'm Fanchon Stinger, live in the Fox 59 newsroom. I'm going to send you back to your regularly scheduled program. We'll see you coming up at 4 o'clock. Have a great afternoon.